Hi, greetings from Japan to distinguished guests, friends from Africa and Japan. My name is Osamu Sakurai from Deloitte. Before we officially commence the webinar, let me take 1 minute for 3 announcements. So next slide, please. Yes, so first, to make this seminar interactive, we would like your cooperation, such as posting your questions to Q&A box, not a chat box. And the moderator or panelist will pick up your questions and answer. We also have pop-up questions at some points of the webinar. And second, as the program is very tight, we are going to have a strict time management. Number 3, companies with the presentations and Japan Business Council for Africa, JBCA, and the government of Japan will jointly take follow-up steps. So feel free to contact us anytime. And as for the contact information, we will announce at the end of the webinar, 11 o'clock in East Africa, 10 o'clock in Central Africa, and 5 o'clock in Japan. And now we are moving on to the speeches with which we are going to officially open the webinar. The first message is given by Mami Fukuchi, the Counselor, Office of Healthcare Policy, the Cabinet Secretariat at the Government of Japan, followed by Mr. Yutaka Hada, the Chief Secretariat of JBCA. So now, Fukuchi-san, the microphone is over to you. Thank you very much.
Thank you. Hello, good morning from Tokyo. My name is Mami Fukuchi. Dr. Isa Makumbi, Director of Public Health Emergency Operations Center, Minister of Health, Uganda. Dr. James Kiungwe, Assistant Director, Non-Communicable Communicable Disease, Ministry of Health, Tanzania. Dr. Nazir Alab, Managing Director, Apollo Medical Center, Tanzania. Dr. Mohamed El Sahil, CEO of Maternal Hospital, Zambia. Dr. Amit Thakur, Africa Health Business. Distinguished guests, ladies and gentlemen, it's my great pleasure to welcome you all today. Since August 2019, Japan has signed 6 bilateral memoranda of cooperation on health with countries in Africa, including Tanzania, Uganda, and Zambia, with a view to scaling up our bilateral cooperation in health sector. The memoranda were signed as part of Africa Health and Wellbeing Initiative, which was announced at TICAD 7 in 2019 by the Prime Minister of Japan at that time. The initiative aims to contribute to building better healthcare systems in African countries with Japan's medical technologies, healthcare service, and expenses, especially through business-based bilateral cooperation. Thus far, Cabinet Secretariat has sent public and private missions to some of the countries and hold online events under the initiative. Those activities have realized some advanced effort, such as a project for improved nutrition and health, which led to public-private partnership with WFP and UNDP. I'm very glad to be able to hold the webinar for Tanzania, Uganda, and Zambia today, and hope this event will be a good starter for future collaboration in your countries. Today, 4 Japanese companies are going to introduce their product and service, which may help solve healthcare issues in your countries. They are eager to contribute to improving healthcare in African countries and have already started business-based activities there. During the webinar, we are also looking forward to a vigorous discussion about how we can advance collaborations in the field and what other technology and service are needed to address healthcare issues in rural areas as well as in urban areas. Lastly, I do hope that this event enables all the participants to deepen their understanding of those technologies inspires your ideas of cooperation and then leads the future-oriented joint project. Thank you very much.
Thank you very much. Well, I think it's now the turn for Mr. Yutaka Hada, the Chief Secretary at Japan Business Council for Africa, JBCA. So over to you, Hada-san. Thank you.
Thank you very much, Sakurai-san. Hello, my name is Yutaka Hada as a representative of Japan Business Council for Africa, JBCA. We, JBCA, are working with Japanese government to support Japanese companies' challenge for African market. Our member includes startups, small and medium-sized companies, and even large enterprises. Today, 4 member companies from JBCA will introduce best practices which have been contributing and challenging to realize African resilient health system through their businesses. During the presentations, I would like you to focus on listening not only the practices, but also their ambition of how to contribute and develop better health system together with Africa. Dear African ladies and gentlemen, please kindly give us your constructive feedbacks on each presentation to improve healthcare systems together. Even though we will have only 4 practices here today, Japan has more technologies, products, and services to support realizing African resilient health system. Give us any comments if you have specific fields or themes to work with Japan. JBCA will follow up and connect with related agencies and companies. We hope that today's event will be a catalyst for interaction between you and Japanese companies and place to meet business partners. Thank you very much.
Thank you very much, dear speakers from Japan. So now the floor is taken over by Dr. Amitaka from Executive Chairman, Africa Health Business. So now the floor is over to you, Amit. Thank you.
Thank you, everyone. Greetings from Nairobi, Kenya. I would like to pass on my appreciation to Ms. Mami Fukuchi of the Cabinet Secretary Government of Japan, Mr. Yutaka Hada, the Representative and Chief Secretariat from the Japan Business Council of Africa. Let me also welcome James Kilongwe from the Ministry of Health, Tanzania, Isa Makubi from the Ministry of Health, Uganda, the 2 representatives from the different ministries of health, Dr. Nazir Arab, representative from the private sector in Tanzania, and Dr. Mohamed El Sahili, the representative private sector in Zambia. Today is an interesting day because we'll have 4 wonderful examples of solutions between Japan and Africa. And specifically, this webinar is dedicated to Tanzania, Uganda, and Zambia as a cluster group because we do understand similar challenges affect the country and we do need similar solutions. With the representatives we have from these 3 countries, I believe they will set a wonderful stage giving us an overarching view of the challenges in the health sector. Like we heard from the Japan Business Council for Africa, there are many more solutions in Japan than what we might see here today. But the idea about this webinar is to spur discussion and dialogue, because collaboration is the new innovation. And if pandemic has taught us anything, it's about learning and working together, both from within Africa, amongst ourselves, but also with friends and partners. Japan is a true friend of Africa. We have done so much in healthcare. We appreciate what we have been able to achieve, and we appreciate what we might be able to do more in the newfound public health order in Africa. Through this partnership, we are looking forward to strengthening our health systems, saving lives and livelihoods across the continent through our cooperation and collaboration. I'm delighted that today we have wonderful representatives from Uganda, Tanzania, and Zambia to set the stage before we listen and hear from all the wonderful 4 companies that have given us their time today to share what they have been doing and what they would like to do at the rest of the continent. It's my pleasure to work with the team from Japan, and I look forward to working with the Cabinet Secretariat, Japan Business Council of Africa, to do much more beyond the webinar. I want to thank the attendees who've also taken their time out to join us. I see doctors from Tanzania. I see hospital owners from Tanzania. I also see lots of representatives from Uganda, also on the attendee list, and also from Zambia. And I want to thank you. I also see there are other representatives from the private sector from other countries besides Tanzania, Zambia, and Uganda. And I welcome you all, because I believe this is the beginning of a super collaboration for better healthcare. With these few remarks, I would like to now welcome on stage Dr. James Kilogwe, who is the Assistant Director of the Non-Communicable Disease at the Ministry of Health, Tanzania. Karibu sana, na tunashukuru umepata nafasi ya kuongea na sisi. And that was a welcome message in Swahili to Dr. James Kilogwe to address us. James, the floor is yours.
Thank you very much, Dr. Amit. As he introduced, I'm Dr. James Charles Kilogwe. I'm the Assistant Director for Non-Communicable Diseases at the Ministry of Health, Tanzania. And I'm representing the ministry on behalf of the Permanent Secretary, who wished very much to be here, but due to other competing issues, has delegated it to me. Now, on behalf of the ministry, I must say that the ministry is delighted to participate in this important meeting, aiming to introduce Japanese companies that are eager to contribute to improving healthcare in Africa, Tanzania in particular. The Ministry of Health, as said earlier, has the Memorandum of Cooperation with the Office of Healthcare Policy, Cabinet Secretariat, and the Ministry of Health, Labor and Welfare of Japan. And recognizing Japan Africa Health and Wellbeing Initiative, which has the purpose of improving healthcare services by using several approaches, including business-based approaches. The country suffers from a number of challenges, and these include the increasing non-communicable disease risk factors and the burden of non-communicable diseases, the inequalities between the urban and the rural population, the poorest and the rich household, and also between the regions in terms of access and quality of health services. Much more, we also have the shortage of human resource in health that is around 50%, and also the digital systems, that the rate of innovation and of the technologies. I must say that the development in our society has posed new challenges. Hello? Are you hearing me?
Yes,
Yeah.
there was a bit of a break, but James, you're back.
Okay. The development in our society posed new challenges to the Tanzania health sector. The demographic and epidemiological transition lead to more aging population and more non-communicable diseases. Industrialization and urbanization demand new types of services for the urban poor. Also, we have the challenge with the climate change that lead to extreme weather conditions that experienced in the past with epidemiological impact, and also globalization in trade and human travel, which has posed the spread of diseases like the spread of COVID, which Dr. Amit has mentioned. But more positively, information and communication technologies offers new opportunities, ranging from electronic medical records to telemedicine and online supervision and training and healthcare education. The ministry welcomes Japanese companies to invest in Tanzania. Tanzania has a comparative advantage for investment, and its comparative advantage for investment lies in the abundance of natural resources, young population, rapid urbanization, geographical locational advantages, which including the long coastline, and also Tanzania is, by its location, a traditional bridge, being the place of physical intersection of the transport corridors, which link the markets of East Africa community, SADC, that is South Africa, and also the COMESA regions. Moreover, the presence of Tanzania Business Council and Business Forum, Tanzania Private Sector Foundation, this helps to link business and companies which would like to invest in Tanzania. And I would urge for those companies which would like to invest in Tanzania, we have more information which you can access through the Tanzania Investment Center website. We have a Tanzania Investment Center which really guides on how really you can invest in Tanzania. I would like again to say thank you very much for welcoming us to participate in this important webinar. Thank you very much.
Thank you, Dr. James Kiologwe. That was very, very clear. I'm very glad to hear about Tanzania Investment Center. Thank you for sharing that TIC information. I also think you talked about TPSF, which is really good because we need to carry on our conversation. We will keep in touch with you for scaling up investments in Tanzania. But I also heard you talking about that the aging population in Tanzania could be a challenge, and that's where you will be dealing with NCDs. And you mentioned many other factors where health system is a big focus for the government of Tanzania and your ministry. I wish you all the best. We've been watching your progress, and I want to congratulate you for the hard work that your ministry is doing. You have the support from the private sector, and I look forward to engaging with you. Thank you, James. I would now like to welcome on stage a representative of the private sector, a very well-known physician and an accomplished entrepreneur who's based in Dar es Salaam, Dr. Nazir Arab, who is the consultant surgeon and the managing director of Apollo Medical Center in Tanzania, to give us a few remarks. Dr. Arab, the floor is yours.
Sorry, my mic was off. Hi, Amit.
Hello, Nazir, welcome.
Can you hear me and can you
I
see
can
me?
hear you very clearly. The delegates and the panelists are very delighted you can be with us, and we can hear you clearly.
Can you see me?
We can see you also very clearly. Thank you.
Thank you. Wonderful. Okay, first of all, I would like to thank the entire organization of taking up this lead in actually coming up with a good, to introduce a good country to invest in Tanzania. Japan is very well known for its quality and very well known for its standards. We have learned something about 5 S's from Japan. So with this, I am Nazir Arab, Managing Director of Apollo Medical Center. I would like to directly hit to the subject that has been asked to discuss on. I would like to say to discuss about the situation of health sectors in Tanzania. We have a population of about 59.6, about 60 million, and a rural urban population is 33 to 66% in a ratio. We have had a progress, and we have made a good progress in the life expectancy age-wise. There is a tremendous reduce in the neonates and child mortality and childhood malnutrition, but a lot is desired in this area. Urbanization, as very well said by James, is definitely something which is taking a lead, but still, child attention is quite needed. Urban child need attention, and adolescence and childbearing remains at a high demand over here. Health facilities, though, have doubled up over the last decade. Still, we are having a shortage of human resources, which is nearly to the ratio of about 50%. Now, what is desired? One of the most important things is, of course, we need to actually see that how we can actually further improve the pregnant and childbearing women's and the neonatals' needs, and to improve the urban children. Inequality between urban and rural population, poor and rich, and among the regions needs to be given an attention to. Coming down to the factors that actually are slowing down the process in the private sector, and which is directly related to how the TIC is looking at it, how the ministry is looking at it, and how the government at large is looking at it. One of the main factors is that we have to look at the governing, the regulatory bodies which are governing the regulations. They are up to date, they are up to mark, but they have to improve upon so that there are no hurdles for the private sectors to come in and invest without any hindrance. We are open to encourage them to come. We are ready to collaborate with them. We need to address one thing, and that is that it is not going to happen overnight, or it is not going to happen in a couple of years. The process has to be slow. The Japanese are most welcome, but if they can come in stages, for instance, we have 3 things that we need to address. One is that we need products from there. Second thing is that we need their trainees to come and train us into the advances in the development that has taken place, in the field of medicine, in terms of diagnostics, and also in the therapeutics. And lastly, that we are targeting UHC. By 2030, we are supposed to be actually taking up our UHC at a very high level. At the moment, as far as the statistics are concerned, we are only covered by about 16 to 18% under the NHIF scheme. We need to grow in that. We need to make sure that this scheme takes up in a very, very firm way so that all the poor are also taken, which is the call for UHC. The other aspect that, that we need to address, and that is that all the sensitive equipments that will be coming in, and those are those we are already having it in the private sector. The problem that we are facing over is that the maintenance of this, the maintenance is a key to actually sustain those advanced, what I call diagnostic equipments. So if that can be even taken care of, then we are looking at something which is quite unachievable. The finances is another factor, and investment into this technology is something which we have never actually thought of, that these things, cost of setting up the private sector is very, very high in comparison to any other business, because health center requires a lot of investments in the equipments and in the advanced gadgets for diagnostics. The percentages of cost in terms of interest are quite high in comparison to the other. So that also needs to be addressed too. Yeah, I would like to emphasize more on the human resources. We are short of by 50% in human resource. And human resource is one thing which is very, very essential in order to actually maintain and to sustain with quality the services in health sector and in the healthcare sector. So these are a few things that I would like to highlight and to actually not caution, but I would like to say that the investors should keep in mind all these things before they really embark on it. We are welcoming them. We are welcoming with the with utmost need. We really need, and we welcome them for these things. With this, Amit, thank you very much.
Thank you so much, Dr. Nazir Arab. I think you have clearly stated that Tanzania is open for collaboration, open for business, and open for partnership with Japan. I heard that. The second thing you talked to us about was there is a starking inequality, and there are people who are having to pay out of pocket a lot for healthcare services compared to the ones who have insurance or are covered. You also spoke about the human resources, saying that you could have all the good equipment and you could have all the infrastructure, but without skilled workforce, you can't produce health. So academic connection, I think this is for Hada-san, that in the relation with the Japanese, I think, ecosystem, academia, and connectivity in improving and skilling up and increasing HRH, human resources for health, will be very useful. Thank you so much, Dr. Arab, for those very good words. I want to move quickly to Uganda now. I'm delighted that we have from the Ministry of Health, the Public Health Emergency Operations Center, the director, Dr. Isa Makumbi, who has a great grasp of the country Uganda. We're just moving. I think we can move through Lake Victoria. We've just traversed across the lake and we've reached the neighboring country. And we have now come to the super country Uganda. Dr. Isa Makumbi, you may have the floor and talk to us about Uganda.
Thank you very much, Amit. We are glad to share the platform with the Cabinet Secretary, the Chief of the Secretariat of Japanese Business Council, colleagues from Tanzania, Zambia, And you, Amit, you are in Nairobi, we are in Uganda, and we are a colleague from Tanzania. We are in the East African community. We are a regional bloc, which is really commercially viable. Uganda has 41 million people, and our health system is in tiers of national, regional, district, and sub-district levels of health centers, 2 to 4. Of course, Uganda is an agricultural country, but trying to industrialize in some of the areas. Uganda's health the indices are not yet acceptable. The health indices are not those which are acceptable, but Uganda is trying to build its health system. And we are even building specialized institutions like Women Hospital, Children Hospital, Cancer Hospital or Institute, Heart Institute, and geriatric establishment. So really the health system of Uganda is growing in areas of specialization, which may need, sophisticated technology here and there. Our disease burden here is really high, composed of infectious diseases and non-communicable diseases. We have some issues with human resource, and especially Uganda is very vulnerable to epidemics because of our location. We are in the belt of meningitis, belt of Ebola, and belts of yellow fever. We have climate problems which give us floods, landslides, and a lot of sunshine here and droughts. And all these really impinge and compromise the health status of the population of Uganda. So these are challenges we are trying to really work with. But however, Uganda is well prepared because we have a public-private policy which really enjoins us to work with the private sector. And we have learned from the COVID that we cannot do it alone. We have to do what we call whole society approach, where all the key players contribute at that stage of improving our health and health systems. So the policy is already here, is already in, and we can use that there to collaborate so that we can really build a resilient health system, which I understand is the aim of this seminar and collaboration. I have been here invited because I coordinate the private sector roundtable. This is a group of companies which have specifically to work with Uganda and implement the targets and objectives of global health security. So I've been coordinating this for the last 2-3 years, and really the relationship is very good. So really working with private companies here is not a new idea. We are already collaborating. My minister is very keen to work with the private because there is a lot we learn and there is a lot they learn from us. So really this collaboration for us, really, we welcome it. And this juncture, I would like to tell you that we are blessed. Aliti, Commissioner Aliti is on, and he's really the one concerned with the partners and sectors to work with the country, because he heads that international relation with the partners and other stakeholders. Mine is really to deal with this specifically for global health security, but of him is more broader. And I would like really, like all my friends, to really invite the Japanese business community or private sector to come to Uganda, and we collaborate together so that we can build a resilient health system so that we get good health outcomes for the population of the country. We would like also to be like Tanzania, to have a memorandum with this organization. Like we have a a memorandum of understanding with the private sector roundtable, which we are working with already. So this is something. So the best way for you to come to Uganda, especially in the health sector, is really to work with the Commissioner Aliti. And of course, if you copy me, I'll be reminding him about this collaboration. But also you can use your embassy here to really come to the ministry, meet Commissioner Aliti and me, and we give more information on how we can start this collaboration formally through a memorandum of understanding. I submit, Dr. Mead.
Thank you, Dr. Isa. I am very delighted that you are championing the private sector roundtable. I have heard a lot of our private sector partners have been participating. The president of Uganda also is giving a lot of focus on the private sector. I also heard from you that the all of society approach is the new methodology on strengthening health systems, the only way we can leave no one behind. And since we want to leave no one behind, this inclusive methodology that Uganda is taking is fantastically admirable. I also want to reach out to Tom Aliti, who you mentioned as the commissioner. Sir, I'm very delighted that you're with us, and I'm going to request you to also join us and speak to the audience here today, if you can be brought into the room. I know our team is bringing you here. If you're already here, would you like to say hello to us? If you are already with us in the room, people would like to hear from the commissioner. Mr. Tom Aliti, are you already with us? If not, I'll bring you onto the stage a few minutes later, maybe after Zambia. But let me, on behalf of the organizers, the Cabinet Secretary of Japan, Japan Business Council, and all the members in Japan and Africa, thank Isa Makubi for this wonderful session that you have had. Tom, I hear that you're with us at the moment. Are you able to give us your greetings from Uganda? If you can hear us.
Yeah, thank you very much, Doctor, and all the organizers and the previous speakers. As was mentioned, I'm Tom Aliti, a Commissioner Health Services, coordinating the health partners, private sector, multi-sectoral coordination. I want to add my voice to express our appreciation for the strong partnership between Japan and the African countries. This consistent collaboration has, to a larger extent, improved our health systems and well-being. And we want to underscore the excellent collaboration also between our African countries. As Dr. Makumbi had said, indeed, we have a very good environment for investment in the health sector. We have, of course, a very good young population, a vibrant public-private partnership framework. We work very closely with the private sector, who provide almost 50% of the services. We look forward to support the Japanese investors in terms of providing all the guidelines, the policy frameworks which can enable them to invest. We have a big area of diagnostic equipment, especially specialized diagnostic equipment. We have very big referrals abroad because of diagnostics, and we needed this to be revamped in the country with Japanese technology and improve on our specialized diagnostic capacity, which should be tailored with the biomedical support in terms of training of our students. Otherwise, thank you very much. And this is in line with the TCAD 2019. I was a part of the team who joined the Honorable Minister of Health of Uganda in Japan, in Yokohama, and participated in all the discussions. And I think this is a very good follow-up, and we look forward to supporting and working together to enhance this partnership. Thank you. God bless you.
Thank you, Mr. Commissioner. We are delighted to hear your voice. Please stay with us and collaborate and see the collaboration we are having with the Japanese companies. And we look forward to further engagement. I know we are running short of time. I want to move quickly before we go to We Inc. Can I briefly invite a representative from Zambia, who is also a successful entrepreneur, and the country of Zambia today is going to be represented by Dr. Mohamed El Sahili, who is the Chief Executive Officer of a hospital in Lusaka, Medland Health Services. So, Dr. Sahili, the floor is yours.
Thank you, Dr. Amit, and good morning to everyone today. All protocols observed. I will be very brief, actually. And let me start by what are we looking for? Not as a Zambian company or a Zambian healthcare sector, but in general, in Africa, what are we looking for? We are looking for a provision of a healthcare with quality, ensuring affordability, accessibility, and agility. That is in line with the vision of Medland Hospital. And when we look at what we have done, for example, as a private sector, Medland Hospital has released an official hashtag, Together We Are Ready. And that complements what Dr. Thaker has just said, that only when we work together, we will be able to overcome the challenges. Two, in our newly updated vision, we said that we will not do things the way we were doing it in the past, meaning that we will stop doing sick care, where we are only providing solutions after a symptom or a disease, but we will start doing real healthcare. And that real healthcare cannot be done without reliable, innovative partners. Three, every time we meet, every time we gather, we do mention the word PPP, public-private partnership. Some people, they add a fourth P to talk about the importance of including people in our vision. I would like to add a fifth P, which really talks about a private partnership. We cannot continue having a relationship based on a supplier-client basis. We have to work as partners, and that needs a transparent and a very innovative way of seeing things. Fourth point is when we talk about UHC. Everything that we are doing, even our meeting today, is to empower governments, public sector, private sector, so that we can reach the UHC, the famous UHC. That cannot be done if affordability is not there. And for affordability to be there, as well as accessibility, we need cost-effective solutions. And that is the only way we can really reach UHC. Having said that, it is with no surprise that we have to rely on innovation, on technology, to improve efficiency, to increase the productivity, and to optimize the patient outcomes. And I do believe that Japan and Japanese companies are very well positioned to provide that innovation and that technology. From our very own experience at Medland Hospital, we are working with Fujifilm, we are working with Hitachi in terms of medical equipment. But we are also working with Terumo for medical consumables. That means that the technology that is a renowned sector in Japan can be introduced in our daily operations so that we can provide healthcare that is affordable to everyone, healthcare that is accessible, because I have seen solutions with Japanese companies that we are using to reach our rural citizens, as well as results that are efficient enough to reduce as much as possible human errors to lead to very accurate solutions that will enable us to treat people not only physically present, but also we have to mention that e-health is becoming a major part of our activity on daily basis due to COVID-19. It has accelerated that access through virtual platforms. And again, I think that the technology that is being used in Japan has shown a lot of efficiency. Thank you. Over to you, Dr. Amit.
Very good. Very spot on. Thank you, Dr. Mohammed. I learned about the 5 Ps today, and I talked about the UHC as well. Let me move on quickly because our companies are ready. I want to invite Dr. Isuke Shimizu and Mr. Shintaro Nakayama, who are both of We Inc., and they would like to give us their first presentation of the 4 companies that we're going to witness today. The floor is yours to the We Inc. team. Over to you.
Thank you, Dr. Amit. Can I share the screen?
Go ahead.
Great. Thank you very much. Again, thank you very much. Good morning, everyone. My name is Shintaro from We Inc. And then together with me, we also have Dr. Isuke, a CEO of our company. And today, I'd like to introduce you about the new remote diagnosis model of the ophthalmology, which can detect eye diseases using a smartphone attachment medical device, which invented called Smart Eye Camera. So let me introduce you briefly about our company. We Inc. is a Japanese medical startup funded by the ophthalmologists from Keio University School of Medicine, which is one of the most biggest and the prestigious private universities in Japan. I'm in charge of a business side, and then together with me, we have some colleagues in the business side as well. And also we are teaming up with hardware engineer, software engineer, and machine learning engineer. This is our product. It's called Smart Eye Camera. It is a smartphone attachment medical device with which uses light source and camera function of the smartphone, and which enable to diagnose the anterior segment of the eye with equal function to the existing slit-lamp microscope. I think it's easier to demonstrate how it's like by seeing my camera. Can I see my camera? So this is the Smart Eye Camera. It's a very light device. And this is a smartphone. So we cover the device on the smartphone like this. And now the light of the smartphone changed to the street light so that you can diagnose here like this. Can you see? Okay. You can also take a movie here so that the video which has been taken can be played like this. So, thank you very much for your reaction. But this is our technology, which we like to introduce today. So likewise, the existing slit-lamp microscope, it can generate 3 types of lights. I demonstrate slit beam, but also it can generate white diffuse light and blue diffuse light. And likewise, existing slit-lamp microscope, you can diagnose almost all types of the eye with the anterior segment of the eye, including cataract, which has been the major cause of the world blindness. Our vision is to overcome 50% of world blindness by the year 2025 with our device. Perhaps you may know better, but right now there are 43 million people blind worldwide, but more than half of them are blind because of the eye diseases of the anterior segment of the eye, which can be detected with our device. And it is also notable that majority of these patients are blind because of reasons which can be curable and preventable. So what it implies is that majority of these patients are living in the rural areas, marginalized areas of the developing countries. There, they don't have any access to ophthalmologist. They don't have any access to the ophthalmic medical device. So they don't have any access to ophthalmology itself. That is why they cannot get diagnosed and they cannot receive medical solutions. That's why they got blind, because of reasons which could be preventable. With our device, we like to make a difference to the situation. This is something, the model that we like to establish. And according to our experiences, in many countries, perhaps these 3 countries today as well, the number of the ophthalmologists is very limited. And plus, most of them are concentrated in the city area. And in the rural areas, there are many patients suffering from eye diseases. However, in the rural clinics over there were no ophthalmologists. There were no even medical doctors in many cases. The clinical officers over there are trying to solve the patient disease with very limited resources, techniques, and then experiences. And in many cases, there is no communication between the clinical officers in the rural areas and the ophthalmologists in the city area. With this device, we like to make a difference to the situation by having clinical officers diagnose the eye of the patient in the rural areas with their devices, and they share the captured images through our software to the doctors in ophthalmologists in the city area, so that the ophthalmologists in the city can diagnose the eye and then provide the result of the diagnosis to the patient in rural areas through our software, which means they can provide them the diagnosis without actually getting there. So through this is a model that we like to establish with our device to conquer world blindness. As I demonstrate a little bit, we already developed a software application in which you can capture the images in very secure condition, preview the images, and also send a consultation request to the doctors in the remote area, all within this software. Also, since we are a medical startup funded by the ophthalmologist, we put the highest priority in terms of the scientific evidence of our device. So we already got many research papers in which we demonstrate the performance and the possibility of the our device with equal functions with cellular microscope. This is a scientific evidence animal-based survey, and we also have a scientific evidence in the human experience as well. And then it's also the research paper in which we demonstrate that this device can also possible to evaluate the anterior chamber depths with the device. And this device has already been registered as a medical device in Japan, and then we got acquired CE marking last year. And then in Africa, we have registered as a medical device in Kenya last year. So we like to expand these devices, and then the new ophthalmic model, which can deliver eye care to the marginalized patients in your countries as well. This is a track record of a project. We do not have any track record in these 3 countries today, but we have many track records in the we have one pilot in Zambia, which has been like several years ago. But we have some pilot project in Asian countries and also in Africa, Malawi, Democratic Republic of Congo, and Kenya, and Mozambique as well. And right now there are over 100 projects in 15 countries. So we really like to make a collaboration with you, and then so that we can start a new pilot project in your countries as well. Yeah. So this is a user voice. So this is something that I'm very proud of personally, is that our device has very, very positive feedback from the local doctors who has been actually working on it. So this is Dr. Kumbo Kalua is the ophthalmologist in Malawi Republic. And in Malawi, there are only 14 ophthalmologists out of 80 million. So he's been committing himself a lot to the outreach work for many years. And he's the one who actually tested our device for the first time in African doctor. And he's been using it, and he's very supporting with us. Yes, and so we like to overcome 50% of our blindness with a device, and we are pretty sure that we could make a difference to the situation in collaboration with local medical doctors and ophthalmologists. Our device is diagnostic device. So we are very good at diagnosing, at detecting the patient suffering from eye diseases. However, it should be connected with actual medical solution, which can be done by the local ophthalmologist and the local medical institutions. That's why we really need the local partners. So if you are interested in collaborating with us, please let us know. And we are very open to start new pilot together with you to overcome world blindness together. This is the end of my presentation, but Dr. Isuke, do you have any comments or words? I think it's a little bit out of line. So
can I just ask,
Sure.
give a comment?
Yes, please.
Yeah, I'm looking forward for, usually we have got many NGOs who are dealing with this eye camps and projects.
Yes.
I don't know how can you collaborate with these NGOs to get this moving?
I think if it's gonna be very great if you connect us to them so that we can collaborate, because we started delivering our devices for test use, and then we can tell them how to use very easily for like 30 minutes tutorial online, so that the person who never experienced in diagnosing ophthalmology can pick up how to use it very easily, so that they can use it. So they can go, for example, when they go to the outreach in the rural fields, and they use it so that they can detect the patients with suffering from eye diseases. Then the data can be shared with the software, so that this information can be shared to the ophthalmologists in your countries, in other areas, so that the doctor can think about how to provide the solution, medical solution to them.
Thank you so much. I think, Dr. Arab, there is your answer, that we definitely will share the information and the links. I would like to ask Shintaro and Dr. Shimizu, if you have any other points, this would be a good time. I know you have to go. We will fill the questions for you, for We Inc., and we will send it to you afterwards if there are any necessary engagements. But like Dr. Arab asked, I know many people on this webinar would like to engage with you, and that can follow up after this webinar. Are there any final comments from Mr. Shintaro and Dr. Shimizu? And as I call them for the final questions, here are the poll questions in front of you. Please feel free to answer. It'll give us a good chance to get the information. Over to you, Shintaro.
Okay, thank you very much, Dr. Amit. Thank you very much. I'm really glad to see many positive comments in the chat box. And then answering some of them, yes, we are very glad to send some like 1 or 2 devices to the doctors or the NGOs who is committing to the ophthalmology work in your country, so that they can use it and then evaluate the usability and the possibility of our devices, so that we can start the more full-scale pilot project. We always start from very small pilot project with a partner, local partner, who is really keen on collaborating with us, and then we can share the same value to overcome world blindness. So if you know some of the possible partners of us, or if some of you think that you like to work together with us, don't hesitate to contact us at any time.
I think we have a lot of requests already, Shintaro. Even
Yes,
Dr. Isa from Uganda, I've seen Sunil, I've seen another 6 private messages. So we, Osamu, Sakurai, and we need to have a conversation after the webinar. The interest of piloting your product is alive. So let's get ready.
Thank you very much.
And I think we have to manage this process. Thank you, everybody, for the positive comments. I think we may be very happy and congratulate We Inc. for your presentation. And we wish you best for your future meetings.
Thank you very much.
Thank you. We now move to the second company, and I'd like to invite to the stage a combined presentation from Hiroshima University and Castalia Company Limited. Let me welcome Mr. Yasuo Kawabata and Dr. Yoko Shimpuku to take the stage and take us through this presentation next. The floor is yours. Welcome.
Thank you very much. I'd like to share my screen. Okay, can you see my slide?
We can see your slide. Are you able to put it on a slide share mode so it's a bit larger? So we use the full
Slide share
screen.
mode. Is this okay?
It's okay. It's not still slide share. We can see the whole screen with many slides at the bottom and one slide on the left and right.
On my screen, it's already session.
上のディスプレイの入れ替えっていうのを押してもらえますか？
Do me a favor.
やったん
Can you
ですが
stop share? Can you stop share and share again? It might work.
Okay.
Perfect. Now go at the bottom and do slideshow. Or go to the top and see slideshow. On the left, top left, up. Yeah. Oops. Nope.
How is it?
Yes. Excellent. Fantastic. Over to you, Yoko. Now we can see your
Great.
screen very clearly. Thank you.
Okay. Thank you. Habari za asubuhi. Nafurahi kufanya presentation leo. Tuko pamoja.
Asante.
Hello everyone in Tanzania, Uganda, and Zambia. I'm Yoko Shimpuku, a professor in global health nursing in Hiroshima University. Today I'm presenting development of a smartphone app for the improvement of midwifery care in Tanzania. To introduce myself, I am a midwife and a researcher conducting research in Tanzania for more than 14 years. In 2020, I was selected as one of the 100 outstanding women nurse and midwife leaders by WHO, UNFPA et al. Okay, this is the maternal health indicators in Tanzania. The maternal mortality ratio is 556 over 100,000 live births, and births attended by skilled personnel, which means nurses, midwives, and doctors, is only 55% in rural areas. This means that nearly half of women have no access to health professionals when they give birth. And the care coverage varies according to the region. And if you look at antenatal care coverage, women who had 4 times or more antenatal care is only 51%. So generally, Tanzanian women have much less encounters with healthcare providers compared to Japan, where women receive around 14 times antenatal care during their pregnancy. Moreover, the quality of care during childbirth at healthcare facility is an issue in developing countries due to the serious shortage in human resources. WHO published this statement in 2014 because women are often left alone or disrespected during facility-based childbirth. So it is very important to improve midwifery care without adding too much burden to the current frontline midwives. And I'm conducting research based on my midwifery point of view, which emphasizes that keeping normality of mothers and babies and preventing complications are keys, because if women get complications, midwives and doctors need to use more time and effort. I investigated women's perceptions and developed educational materials which can be effective in women and their families. I collaborate with Dr. Beatrice Muelike and others in Muhimbili University of Health and Allied Sciences. Our research outcomes show that our education improves health outcomes of mothers and babies. We have published several research papers already, and I'm trying to make my materials more accessible from anywhere in Tanzania and incorporate my findings to global standards, the WHO guideline. But the difficult point was how I can collect the detailed data from the app, like how long midwives are learning, which content are used the most, and so forth. And I met the CEO of Castaria, Mr. Yamawaki, and he explained the mobile learning platform called GUCAS, and it can solve my issue of data collection. Moreover, he is very passionate about using technology to help people in Africa, and I trusted him very much. So I decided to move my research forward with Castalia, and now Ms. Minami Suzuki is helping my implementation research. We developed a social media function in the app so that information can be provided not only in one way, but with interactions. Our feasibility study showed that midwives kept using the app for a long time, and knowledge score improved when compared before and after using the app. And all midwives agreed that they want to make pregnant women happy with the information in the app. For the next step, we developed another app for women. It is called Personal Health Record, which is like Mother and Child Handbook in Japanese Boshtecho. Through the app, we want women to access to the personalized information and have interaction with other women and midwives. It's easy for midwives to conduct examination and put information. I wonder if I can show the video. And women can receive the data at home or any places. And I hope these ads can help both midwives and pregnant women and their families access to information and healthcare. Thank you very much.
This is very, very well presented. I am very delighted that you also had a chance to travel, Dr. Yoko Shimpuku, to parts of Africa. Which countries have you been able to travel to?
For Tanzania, I go back and forth for more than 14 years. So I cannot count how many times I've been there.
Many, many times. Tanzania is lucky to have you travel many times. Dr. Isa is also saying that this could be a game changer app for Uganda. So Dr. Isa and everybody else who is on this call would like to engage with you after the webinar. The poll question for the attendees is now up. Are you professionally interested in the services, and would you like to discuss with Castalia, Dr. Shimpuku, future collaborations? Please answer the question so that we can...
Dr. Taka?
Yes, of
Dr.
course.
Taka?
Yes.
I want to show the brief introduction of our company and how we plan to expand this project. Okay.
That's correct.
Can I share the screen?
Yes, please go ahead.
Thank you. Thank you very much.
So Mr. Yasuo Kawataba is now on the floor.
Kawabata, yeah.
Kawabata.
Thank you very much.
Yes, Kawabata, yeah. The floor is yours.
Thank you very much. Hello, habari ya asubuhi in African people, and habari ya mchana in Japanese people in Japanese. So my name is Yasuo, and I'm in Castaria, and we are working very closely with Professor Yoko Shimpuku. So as Professor Shimpuku-san showed us the issue of why we are doing this project in Tanzania. So I want to introduce very briefly about our company and how the project will go on in the future. So the application name is Tarifa's Mama. That means mom's record. And this is a pair of application for expectant mothers and midwives. So our company is a kind of edutech company. It's a kind of education technology company based in Tokyo. We have several projects in Africa and Middle East, and Tanzania is one of them and the newest them. And the point is, Tanzania's project is our first project to working with a midwife and expectant mothers. So the project owner of this project owner is Minami, but she is now in Tanzania now. So today I will introduce mainly the business side of the project. So as Professor Shimku introduced, the project was started in 2019, and the first step was mobile learning for midwives. But after that, we expand this project to the expectant mothers. So we developed the application Tarifa's Mama. So application has two parts. One is a midwife part, midwife app, that will be used by the midwife to register the midwife's health condition. The other side is mother app. The expectant mothers can check the situation of their health anytime from their mobile phone. It's very easy for expectant mothers. So now I heard one of the paper is used for the kind of culture for the expectant mothers. But it is very easily lost or damaged or something. But if if the expectant mothers use this application, they don't have to worry about such kind of things. So the point of the application is localization. We studied very deeply about the Tanzanian, everything about the Tanzanian situation. I mean, the people's life, how they use a mobile phone and the economical situation and so on. And we, luckily, we have our own application engineers. We made the application from the scratch. So this is a customly made for the Tanzanian people. So I not only showing the health records, but this application can be used as a kind of educational material, a kind of magazine for the mothers. So educational content is provided from the Professor Shimku and Muhimbili University. And also this application have the kind of communication tool between midwife and expectant mothers. So now the POC is in progress in Dar es Salaam, and Minami is in charge of that. And we are very pleased to have the thank you note for this application, who the expectant mothers just had a baby very safely and very healthy. So we are very happy to have this message on the application. So we are trying to make this application as a kind of sustainable one. I mean, some kind of aid or some donation is good, but it may not be sustainable. If the aid or donation is stopped, the project will be stopped. So we make it a kind of a sustainable social business, because the number of the people in Tanzania is increasing at least next 30 years. That means increasing of the expectant mothers and the children. And I think this kind of situation, kind of advertisement business model can be used or make it a sustainable one. So I want to make it a sustainable business. And now we are talking about this project with some of the Tanzanian telco company. And I think the telecom mobile phone ad is one of the key for this application to make it a sustainable one. So this is one of the sample of the how to show the application, how to show the advertisement on the application. So if you have any comments or questions, please contact Minami. This is her email address. Of course, I can share the information with Minami and working with you. I want to work with you together. So thank you very much, and Asante. Here is my presentation. Okay, thank you.
Thank you so much. This was very good, Mr. Yasuo Kawabata. It was very clear, and thank you for also sharing some interesting pictures of how it all began from those days. And both of you presented very well in a combined presentation from the company and also from Hiroshima. I am sure we will receive a lot of questions and comments. I am looking forward to talking about that at the Q&A. Let me now move on to the third company, which I would like to invite Mr. Fortunate Collins, who is the General Manager of the Saraya Manufacturing Limited. So Fortunate, the floor is yours. Over to you for your presentation.
Thank you very much, Dr. Amit, and thank you very much for putting this presentation together. I'd like to thank the Cabinet Secretariat, Government of Japan, working closely with the Japanese Business Council for Africa, for giving us this opportunity to showcase what a Japanese company has been doing in Uganda and what we also intend to do for the future. If you can allow me to also share my screen so that our presentation can be seen. Can it be seen now? Can my screen be seen?
Not yet. Let me see if I don't see it. I haven't seen your screen yet. Could you press share screen and try and do that?
Okay, let me try and do that.
If you press the green button, share screen at the bottom, and then go and pick the window of your share, that might work.
Let me try that. And
we still can't see it. Did you manage to press the green button?
Yes, I have.
And then when you press the green button, you should be able to see a few windows on a white.
Yes,
so don't press the white. So before you even press the green share screen, you should have opened the PowerPoint earlier on your screen at the laptop. So if it's not working, open your PowerPoint. So open your PowerPoint first. Don't minimize the screen.
The PowerPoint is actually open.
Okay, then press the green button. When you press the green button, can you see your presentation?
I'm not seeing it yet.
Yeah, so I think we'll have to keep moving, Fortunate. Unfortunately,
okay, in the interest of time.
Yeah.
In the interest of time, let me just
we should move. If we had your presentation with us, we could have presented it. If this is the presentation, we will push the slides for you and you can speak through this. Do we have more slides? Not really. Next slide.
Yeah, next slide.
Yes. Okay.
Okay, so briefly, the Saraya Manufacturing Uganda Limited is part of the bigger Saraya company, Global. We started out in 1952 in Japan, in the city of Osaka. That's where our headquarters are. We came to Uganda in the year 2011, but in 2014, we opened up a factory where most of the products that we deal in the country are manufactured. We have a production plant in a place called Kakira. Those of you that are familiar with Uganda, that is where our factory is located. Our major purpose really is to contribute to improving the overall condition of sanitation, environment, and health globally. Those are the three pillars by which we operate. And we are currently in 30 countries, 30 offices across the world with 11 factories at different parts of the world. As I mentioned, the key areas is in improving sanitation, health, and environment. That is done in, I would say, 4 major areas. The first one is the area of medical hygiene or healthcare hygiene for that matter. And I think in Uganda, that is where we are most known for. Then there is also the area of food hygiene, as we know that bad food or food contamination could also greatly affect our health. Then we also have the area of public hygiene, and finally the area of personal hygiene. If we can go to the next slide. Okay, so one of the areas that we are very passionate about, one that we have dedicated a lot of our efforts, especially in Uganda, but also in many other parts of the world where we operate, is in the area of infection prevention and control. One of our flagship products is a hand sanitizer called Alsoft V. I'm proud to say that we're, I think, among the very first people to open up a production plant in East African market to deal in a highly effective, simple product of a hand sanitizer. We are using ethanol produced from, it's a byproduct from the sugar processing, the sugar process. And that's where our factory is actually located. This product has been widely used in Uganda in medical facilities, but also in other public spaces. It's a product that has been at the forefront of fighting different pandemics. As Dr. Issa earlier mentioned, Uganda is prone to different pandemics because of our location. At the time when we were dealing with the Ebola crisis in in Western Congo, but also in Uganda itself, Alsoft V, which is our product, was very largely used. And of course, at the advent of Corona, it was also a very useful product in preventing the escalation of the crisis in the country, but also in the region. So that is a product that we're very proud of, that we have manufactured in Uganda, and it's being distributed across different parts of the region, not only in Uganda, but also to Kenya through our subsidiary called Seraya Kenya Limited, to South Sudan, and I'm sure in parts of Tanzania as well. This product has also been very, very useful. We're also introducing another product called scrubbing. It's a surgical scrub meant to prepare the medical personnel that are going to carry out different surgical operations in theaters to make sure that they're well sterilized, to deliver a safe procedure for the different patients that are seeking out services. We have another product called Saraclean C, which is a surface disinfectant, both for medical grade, but also for public spaces. The difference between the hand sanitizer and the surface disinfectant, Saraclean C, is, of course, we know the active ingredient is alcohol, ethanol, but for the surface disinfectant, to make sure that we maintain the integrity of the surface where the product is applied, we added a different ingredient called benzalkonium chloride, which helps to maintain the original state in which the surface is without causing any paling or discoloring and that kind of effect. We are soon introducing a different product called acecide powder. This is a very high level disinfectant that is mainly used for endoscopes. In Uganda's case especially, the practice that we have always had and which still reigns up to now is the use of jig, but we know that jig has different challenges. One of those that it causes corrosion, but there is also the risk over time of it losing its efficacy as a result of failure to maintain a consistent mixing level. So acetate powder is a product that we are soon introducing. It's been used in many other parts of the world, but we also feel that it's about time we introduced it to the Ugandan market. We hope that we shall get the support of Dr. Makumbi and the entire team at Ministry of Health to roll this out to the different medical facilities across the country, so that our healthcare provision, as we aim to achieve the universal health coverage, is also attained by the use of internationally recognized products that can also be competitive from across the world. Can I have the next slide? In working to attain the infection prevention and control, we have also worked very closely with other professionals, other authorities that are leading in this area, and one of those is Professor Didier Pite. I'm sure many of us have heard of him. He's the external lead for the World Health Organization Global Patient Safety Program called Clean Care is Safe Care. We have hosted him in Uganda. He has given different talks to different medical professionals. He has trained our staff. We have attended different symposiums that he has organized, him and his team, so that we can equip ourselves with the latest knowledge, so that we can share with the communities and the hospitals in Uganda. We have carried out research to ensure. Can I have the next slide, please? Yes, I was saying that we have carried out different research to show the efficacy, not just of our product, but also of the theory that we are championing. We know that many parts of Africa, especially Uganda, challenges of availability of clean water in medical facilities is very difficult, which makes alcohol-based hand rub a safe and efficient solution in providing or reducing cross-contamination. So earlier on, we carried out a research in a place called Gombe with Dr. Lule. Dr. Lule is the gentleman in a doctor's coat that you can see in one of the pictures, where we showed the efficacy of alcohol-based hand rub. And the blue line shows that as compliance to the use of alcohol-based hand rub increased, there was also reduction in acute diarrhea among babies, but also reduction in post-cesarean section sepsis, which is a research actually that won Dr. Lule an international award. And this is evidence that this product can actually be very useful in reducing of infections, not just in hospitals, but also in public places. And we continue to promote it, believing that it can actually be of great help in attaining the universal health coverage as is advocated for by the World Health Organization. Next slide. Can we have the next slide? We are currently also conducting a research in Eastern Uganda, covering 4 different districts. Again, the idea is to promote the use of alcohol-based hand rub as an efficient tool in infection prevention and control. We are carrying that out in the area of Mbale, Umi, Tororo, and Busia. We hope to publish these results to the different stakeholders to show them the efficacy of not just our product, but also of this concept of consistent use of alcohol-based hand rub as a cheap and efficient item that can help us to improve our healthcare systems, but also avoid mortality that comes as a result of cross-contamination and other diseases acquired from our different at different medical facilities. Next slide. If you can go to the next one, in the interest of time.
Thank you.
Finally, one of the areas that I would like to highlight, as Dr. Nazir Arab earlier mentioned, is the global challenge of the non-communicable diseases. And among those is diabetes or obesity. Globally, the number is at 463 million people suffering from either diabetes or obesity. In Uganda, that number is at 2.3 million people, which is presenting a very big health burden to the medical facilities, not to mention the patients who are suffering from this. And this presents a mortality rate of 9,860 cases per annum globally, which we believe is honestly a very, very big number. I need to mention as well that while we've managed to get statistics for Uganda, given the challenges of our medical records and our failure to adhere to strict diagnosis, 80% of the cases of obesity or diabetes isn't actually recorded. So 2.3 million could easily be a much, much bigger percentage than that. But at least for now, that is the official record. And that is as a result of the different health challenges that we face. It could be our diet, it could be our lack of physical activity, it could be many other reasons, but eventually present a very big challenge to us. So if we can have the next slide. So what Saraya has done to curb this global challenge is we have come up with a natural, zero-calorie, natural sweetener. It's made from a fruit that is grown in China. In Chinese, I think it's called luo huan guo. It's 300 times sweeter than natural sugar. It has been used by the ancient Chinese as traditional medicine and has actually been classified as a superfood. At the moment, it is the fastest selling sugar replacement product on Amazon, and we have managed to extract the sugar and package it and present it as a healthier alternative to natural sugar. So this is a product that we believe will go a long way in alleviating the challenge of obesity. Those numbers that we earlier saw that are quite frightening, this product can go a long way in helping us reduce that challenge. We encourage all of us to, in addition, of course, to having a healthier lifestyle, to also adopt it so that it can help us in attaining those goals that we aspire for. It is as sweet as sugar. It is heat stable. It can be used for baking and all other cooking procedures. It can be used for juice, and the keto diet community is actually using it a lot. We encourage all of us to try it out and see how much better we can improve. In short, that is our presentation. We thank you very much for this opportunity. We can now take any questions from you.
Thank you so much. Thank you so much, Fortunate, for that presentation.
Thank you very much, Doctor.
We are quite happy. If there are any burning questions, I would like the attendees to attend to the poll question that is right in front of you. As you can see it, it's about question 1 and 2. Thank you for answering, spending a few minutes. I would also like to let you know, Fortunate, that some of the follow-up is going to be done immediately after this webinar. And as people digest your presentation, I know you were very clear about your impact on NCDs and also on the hygiene, overall hygiene in the health ecosystem. I think that came out very clearly. Your different array of products, again, are going to be used in public health quite significantly. I know Dr. Makubi and also Isa Makumbi and Dr. James Kiologwe will come back to you during the Q&A session. I would then, while if you can stay on, I would like to invite Christian Hunold who is going to take our next presentation, and she is from Fujifilm and Fuji Corporation, actually. Fujifilm MEA, and she's in charge of clinical marketing and education. She's the strategic innovations manager, and I'm really, really delighted to bring her up to stage right now for the next presentation. And then I'm sure we'll have a lot of time for Q&A for the attendees who are there. So Christiana, the floor is yours.
Thank you very much, Dr. Amit. Good morning, everyone. Can I share my screen, please? Do you give me the permission? Good. Good morning, everyone. Thank you very much for having me here. I'm presenting in the name of Fujifilm Middle East and Africa, the healthcare solutions for a better tomorrow. So we had already initially the discussions and the inquiries coming from the respective persons of the countries, Uganda, Zambia, and Tanzania, that the focus is not only the deliverable of the healthcare product, but of course with the technology being improved to really set on there where the problems are. And the innovations we present in equipment and technology, they should of course make sense to your countries and to that what you need in your country. And I'm circling today a little bit around screening, the artificial intelligence and teleradiology. And why am I doing it? Because of the reasons you have mentioned earlier already. You've got this serious shortage of human resources in the field of healthcare. And the amount of specialists being on hand and actually providing the healthcare service, that is a big pain point in all of your countries. And when we talk about how we can improve the healthcare services, equipment and technology is one thing, but it should of course be tailored to what you suffer the most with. Fujifilm is an essential healthcare provider, but what is very special about us, and that is that what I'm doing in my job, I'm the strategic innovations manager. I'm pulling the equipment together to make ends meet for the end user. So I have a lot, of course, to present at the end of the day, because Fujifilm, look at all this portfolio. This is a tremendous amount of equipment and solutions we're offering, but I cannot bombard you with all these products and all the technology. But what I want to bring closer to you is how can we bring a better healthcare services to you and your citizens with the innovations of the technologies. And those should be, of course, bundled with the ideas of how can we implement it into a screening concept? How can AI, artificial intelligence, disrupt the common workflow and create a workflow that helps you in your environment and in your facility? And where do we have to pick up the telehealth aspect? The human resources are very low, as we know. Where can we provide the services of teleradiology, for instance? So when we see this holistic circle of combining the technology with certain attributes, I hope that with my presentation, I can deliver some ideas where you would want to listen to what we can provide in your country. And of course, digging into the pain points and the issues you face. So let me just start with a few products and picking up some ideas. I mean, when we talk about screening, yes, we have mentioned in an earlier discussion, we don't want only to provide a healthcare solution when the status of the patient has come already to a very late stage. We all know that screening is, of course, an essential part to, of course, save the patient's life, but also not to expend the financial resources in the treatment, but rather taking it onto the first stages. So mammography screening is, of course, a big topic. Mammography screening with a combination of AI and artificial intelligence workflow, what does it actually do? It will help to bring a faster and more secure decision on the spot with an AI detection of pathology. This AI detection of pathology that can be even combined with, of course, digital mammography, but also we should not forget that all the existing equipment you have, the analog units, they could be equipped with either a CR or a DR retrofit flat panel detector, which then can work in a holistic screening program with an AI support. Here again, we should look into how could we tailor this mammography screening with an AI support, including a teleradiology support to support the entire workflow of actually establishing a mammography screening program in your countries. That takes me further now into the chest screening services. Again, here we provide an artificial intelligence support. And you can see the sample images actually here on my slide, the chest image with the color code mapping the highlights of the pathological findings, and then the mammography image here on the left side. I don't know if you actually see my mouse moving, but these are the typical AI reports which indicates pathological findings. And once you've got these pathological findings in place on site, the reaction, the follow-up, and the diagnostic pathway becomes way more clearer to the healthcare staff, the doctors on site. Moving forward here, sorry for interrupting myself, the chest screening services. Fujifilm, of course, provides a wide range of X-ray, stationary, portable, ultra-portable, and I go a little bit into detail later on, but the aspect of having the portable or the stationary machines equipped with a chest AI, that expands the idea on where can we actually use this. We can support ICU, we can support, of course, NICU, we can take it into remote areas. Our ultra-portable X-ray unit can be taken wherever you want, but what helps us here is the artificial intelligence system or the software provides a diagnostic support on the site, on spot. So looking into the screening of chest, we are evaluating the 10 most common chest diseases, of course, that would help in tuberculosis screening, that would help in HIV-related tuberculosis screening, that would, of course, support in COVID-19 lung disease screening, and all that can be combined with a teleradiology service as well. We do have a lot of experience in screening, not only mammography screening. I've listed it here, multiple countries where Fujifilm actively supports screening solutions with IT as well as equipment, but also for the campaigns, TB Stop programs in Cameroon, Nigeria, and Zambia, as well multiple other tuberculosis screening projects worldwide. Computer tomography helps as well with a combination of artificial intelligence in lung screening, but not only in lung screening, but also in brain pathology detection. So you can see we have equipped pretty much all of our equipment with an artificial intelligence system, which helps and promotes a faster decision-making on the spot, which leads to a good diagnostic and a straightforward direction for the healthcare professionals, the doctors, the radiologists, the radiographers even on site. They can be involved in those new workflow, disruptive workflow activities. we provide IVD, Fujifilm Pro, and we've got a division, IVD division, in vitro diagnostics. Maybe some of you know, some of you might not know, but what can we do with the IVD to support the healthcare industry or the healthcare approach in your country? Rapid diagnostic tests, the COVID-19 test or the tuberculosis lung test, which is tested in Zambia. I've mentioned it here on the slide, Lusaka. But also the fecal immunochemical test, the CRC screening, for instance, or the HCC liver cancer screening. So IVD is on the forefront here as well, providing a screening tool with an AI combination. I spoke earlier about the portable X-ray machines. They're equipped with our artificial intelligence software, which identifies and helps in detecting lung diseases. I've pretty much mentioned most of those writings here on this particular slide, and I would like to move forward into a small video which I will be playing, and I will stop it accordingly, because this just shows a very typical scene for having the portable X-ray unit used in an ICU, COVID-19 ICU ward. So what it actually does is, yes, you're going to take your portable X-ray machine onto the ICU, take your chest X-ray on the patient, and you can see here I stopped the video on this particular scene. We've got the COVID healthcare workers identifying and talking about the immediate AI report displayed on the acquisition workstation. So the doctor on ICU can take a decision straight away what's going to happen with the patient. Additionally to this, we do have a comparison function on previous chest images to the current chest images. Is there any progress of the patient? What has the treatment worked? Can we proceed with the treatment, or do we need to rethink a certain treatment plan? So I think this technology opens a lot of opportunities to think outside of the common box in terms of, we need to take an X-ray, then we send it, or we print it out, maybe we send it to the PACS, or we have a film, and then it takes a long time for the radiologist to read it, and then we get the results maybe in 3-4 days. So AI shortens the workflow and gives way more disruptive, of course, workflow changes. So that is just one sample of the portable X-ray unit, which we called FEDR Nano. But when I go into our X-ray machine, which you can see here on the top left of the screen, you won't believe it, but it's true. This is an X-ray machine, and that is an ultra portable X-ray machine, which we call FDR-X Air. It's extremely low dose. And what does it make so special is, of course, you can see ultra portable. I can take this unit anywhere, everywhere, with a little travel kit. I have my flat panel detector. I have an access point where all the components are talking to each other, and I can take X-ray. Yes, I do need a power source at one point to recharge the batteries, but I can still provide a certain amount of X-rays regardless on where you are, and provide a remote healthcare service. I can, of course, do more than only a chest X-ray. I can do multiple X-rays on all the body parts you could probably imagine. But thinking into rural areas, tuberculosis screening, COVID-related screening, coal miner screening, home care support, traveling with your equipment from one side to the other, supporting the communities where there is no hospital close by. And that brings me here into a very nice video what we have done with the Stop TB partnership. And this talks about a tuberculosis screening of coal miners And I'm going to stop the video when it comes to the setup and where this equipment is actually used and displayed. You can see it couldn't get any more remote than this. We're very far away from anything. And such an ultra portable and ultra low dose X-ray unit, that is a simple setup here. There is the X-ray machine on the stand, the flat panel detector where the gentleman is positioned, and then we've got a laptop equipment here where we can see immediately the chest image as well as the artificial intelligent report. Very portable, very flexible. We are basically looking into a solution which helps wherever you go. We're carrying on with the flagship of portability, flexibility, remote, but not only that, but as well as having an equipment which endures to be out there. You know, you can't just take every equipment out of a hospital scenario and take it in your car and off you go. It needs to be suitable for a rural use. It needs to be very robust and lightweight. And you might know that Fujifilm has its own ultrasound division, Sonosite. And Sonosite has been, the origin of Sonosite is that it has designed ultrasound healthcare for military base, field camps. Everything on Sonosite equipment is based on lightweight, ultra portability, durability, battery use, ideal for rural use. And we can serve the entire range of ultrasound imaging, from OB and gynecology ultrasound to, you name it, cardiac, vascular. All the Sonosite ultrasound range actually provides that what we need in the field. We do have a very nice project running in Kenyatta public hospital in Kenya. Most of you know, of course, Kenyatta University, and they're very active in training the trainer. And that is one additional point which I will get into in a little while, because having an equipment, having a concept, having a solution is one thing, but where do we stand with the implementation, the follow-up, the quality control, the training, the contact to actually close the cycle? And I've got a little chart prepared on this as well. I heard earlier the voices on home care solutions as well. Home care solution means bringing a certain healthcare services to people at home, which can't go to the hospital, or they are discharged and they just need to have need to be monitored. We are providing a complete home care solution, which includes X-ray, blood pressures, ultrasound, glucose level, and everything related to the immediate results on the patient's home, with a teleradiology and telehealth service here as well. What Fujifilm has done on ODAs, it's plenty. I can't really mention all of them, but I picked now the ones which has been done in Zambia, Toyota Chusho ODA, for instance. And of course, all of you know the clinics and hospitals. So we are very active when it comes to providing the solutions and the technologies we have. We have experience in how to deliver them. We have experience to sit with the local team. And when we talk about the experience in one round chart, what is the ODA? It's our responsibility as Fujifilm. And we do have our own country manager. So that would be the next instance of the quality control of such a project. Then additionally to that, of course, we have our local distribution partners, and we have contractual agreement that they will be implemented in the project and take the certain tasks. So the local project management is handled from Fujifilm over the country managers, over the distribution partners locally placed from A to Z. The distribution partners, they are trained. They're trained by us as Fujifilm Middle East and Africa. So they will be certified to do all the installations, the maintenance, the support, the site visits, and of course, everything comes together with the customer satisfaction process. So when we conclude ODA projects, yeah, they are very complex, but it's absolutely exciting. And our philosophy as Fujifilm, we have launched our Fujifilm Academy here in Dubai. And of course, we are taking care of Middle East and Africa. And our philosophy is to train the trainer. And this is the facility. I'll show you a small little clip later on. But we have, from September until now, we have trained 529 trainees. And we have conducted 181 trainings. So the trainings are not only physical trainings, knowledge transfer online trainings. We have learning management systems as well. That means we have an online platform where we upload training programs, where our distribution partners, our engineers, our clinical applications get their knowledge from, and of course, physically invite them to our Fujifilm Technology Center in Dubai to establish the high level of knowledge and so here you can see the facility displayed. We take knowledge transfer and education very seriously. And yeah, that's basically our mission and our vision to bring healthcare services, but as a complete service package, not only the equipment, but also the idea of pulling things together, designing something which is suitable for you. And you can see we have plenty of ideas, solutions, and equipment. It's all about finding the right negotiations and the streamline and putting the ideas into place. Thank you very much for listening to me.
Thank you so much, Christiana. That center in Dubai looks like an amazing place for many of us who might be visiting to understand and appreciate your knowledge center and your innovation center. Thank you for your open invitation and thank you for the presentation. I want to manage time. You are so true that you have countless solutions and you have plenty. You can't possibly show everything here. But I think with the attendees, you've given them a good glimpse about portability, flexibility, X-rays in the mountains and remote areas, ultrasound that can be used anywhere. The poll question for the attendees are right here. Please answer them so that we can give back Fujifilm some responses. I would like to quickly move on and invite one of our VIP guests to give a little bit of his views. He's from the Ministry of Health, Uganda. He's called Dr. Jackson Amoney. Dr. Jackson, are you with us? My apologies. I was supposed to bring you on stage earlier, but you're with us. And I would like you to give a few comments, especially on Sarai's presentation and what you've heard, even of all the presentations today. We are delighted that you've joined us all the way from Uganda. Dr. Jackson Amoney, the floor is yours.
Yeah, thank you so much, Doctor, for allowing me to say some few words. I've been close to Saraya for over 10 years now. And as you know, my position is a commissioner in charge of clinical services. And I'm interested in the treatment aspect and also a lot to do with public health. And as you know, there are a lot of emerging and re-emerging diseases, which are leading mainly to a number of epidemics in Uganda. As clinical services, we are the people who treat when the epidemics come. And when we are doing the treatment, we usually prevent the people who are not infected, and even the health workers who are going to give that service. So the infection prevention and control is key in our method. And this also goes hand in hand with the healthcare associated infections, which are in the hospitals. And we are trying to avoid looking at the antimicrobial resistance, which are big issues which many of the countries are addressing. So as we do this, we have been working generally with JICA in the 5S project, which has been in the country for about 10 years. And doing that, we had worked very closely with Saraya. And I think Saraya, to the best of my knowledge, as Fortune has said, they were the first to invest heavily in hand hygiene. And because we are implementing a lot of hand hygiene in the infection prevention and control, we had to work with them. And that started a long time when we were having the Ebola epidemic, when we were having hepatitis epidemics. And they have invested now a lot in most of our health facilities, and I work very closely with them to the extent that they donated a number of hand hygiene dispensers in most of our health facilities, which I think was a very good sign that a private partner can work with the public facilities to give a lot of those assistance. And in the event of the COVID-19, we have really seen that the infection prevention and control came very handy, that almost every institutions, every individual wanted to have some hand hygiene equipment and solutions. So Saraya has been on the lead. They have really donated many things to the Ministry of Health. And I think they have stand the test of time for many people who have been using the hand hygiene or the hand sanitizers. And they have been very handy in different forms, in different ways that they have been giving us. And they also contributed a number of times in teaching the population on how we can avoid these infections. Many times when we are celebrating the World Hand Hygiene Day, which always occurs on the 5th of May every year, we have been working together, and they have shown us that they're a very reliable partner, which they can work to ensure that infection prevention and control in health facilities and in the community is really maintained. Chair, I think that's what I wanted to say about Saraya. Thank you so much, and I want them to know that we cherish what they're doing in the country. Thank you, and over to you.
Thank you, Dr. Jackson Amoney. The message is very clear. Thank you, Saraya, for this wonderful engagement that I'm hearing from Uganda on hand hygiene. I think if you can expand that across all of East Africa and Zambia, we would appreciate. We've had a lot of discussions and Q&A. I apologize to the attendees. We've taken a little longer. We've shot over time. We've been able to answer the Q&As along the way. I thank you very much for attending, and I also thank you for answering the questions while the session was going on. I see a very interactive Q&A chat and chat box. Let me move on to the parting shots because we are a little over time right now. And I would like to ask the presenters to really reflect a little bit of what they've heard. I know we are missing We Inc., Dr. Isuke Shimizu and Mr. Shintaro Nakayama. Thank you so much. Your presentation was marvelous. The shout out to you is very clear that more pilots need to be done. People want to see these units, and through the team of Japan Business Council, Deloitte, Africa Health Business will be in touch with you. There is another poll question for the attendees who are still with us. Please tick which ones are going to be most useful in your country. That'll help us. Let me invite onto stage Dr. Yoko Shimupuku and Mr. Yasuo Kawabata. Let me invite Dr. Yoko Shimupuku to say a few words and parting shots. Just 1 minute before I invite Mr. Kawabata. Dr. Yoko, are you with us? Maybe not. So, Mr. Kawabata, over to you.
Yeah. Thank you very much. So thank you for all to have share the time. This great presentation. I was so much impressed other companies' presentation. Also, I'm so happy to have many Q&As for us. And still, the project is going, and we have to caring about many things now. So please contact us freely, and if we can work with you in the future or in the very near future, I'm so happy to with you. Thank you very much today.
Thank you so much for your lovely presentation. It's my pleasure now to ask Saraya manufacturer, Mr. Fortunate Collins, to say a parting shot from Saraya. Fortunate, over to you.
Thank you, Dr. Amit. Again, we thank you very much for putting this together. We thank the different participants for the questions that they've shared with us. And of course, the presenters to highlight the different works that you're doing. We have learned a lot. We continue to avail ourselves. We are present to work with the Ministry of Health. Our products, as I showed in the slide, the factories are GMP certified. We also have ISO certification. So the quality cannot be contested. We are present in Kenya. Hopefully soon we shall be present in Tanzania, but the discussions can go on because this is our challenge. We all need to live in a better world. Universal health coverage can be attained only if we all put our efforts together to make it a reality for all. Thank you very much, and we hope to carry on with this engagement at a later stage. I thank you.
Thank you, Fortunate. Let me now invite Christiana Hunold from Fuji Film to make her parting shots. Christiana, over to you.
Yes, I'm here. Can you hear me?
Now we can hear you. Go
ahead.
Yeah.
Yes. Thank you very much. I'm sorry, I missed the question.
It's just a parting shot. Just say your closing words, and we will then go to the finale.
Thank you very much. It has been an absolute pleasure being a part of this amazing meeting, the webinar. And I'm looking forward to receiving more inquiries, more interest. And as we said earlier, there's so much more to it and so much more to discuss. I can't wait to meet all of you in person in a meeting and elaborate all the solutions we can provide. Thank you very much, Dr. Amit. It's a pleasure being with you as well, and wishing you all of a wonderful day. Thank you.
Thank you so much. And I want to thank all the attendees and also Professor Tomohiko Shugishita. Shout out to you. I know that you are a good friend. You're with us. It's a pleasure to have you with us on this webinar. I would like to now also take this opportunity to sincerely appreciate and thank the Cabinet Secretariat and the Government of Japan. Ms. Mami Fukuchi gave us a very good opening and starter. And welcoming now on stage will be our closing remarks. And we want to get on to the closing remarks. I want to thank, I think Deloitte will come on and give us a thank you message before we move on to the closing remarks from Mr. Hada from the Japanese Business Council. Osamu, the floor is yours. Welcome.
Oh, yes. So thank you very much all for the interactions. And I hope that everybody really enjoys the instructions of a variety of services through Japan's unique technologies. And once again, we are ready for continuous dialogues between Africa and Japan to materialize business. So now we are getting back to the stage of Mr. Yutaka Hada to hear his voice as a representative of Japan Business Council for Africa. So the microphone is over to you, Hada-san. Thank you.
Thank you, Sakurai-san. Thank you for giving our members to show their practices. As I mentioned in the opening, JBCA has a role of supporting Japanese companies who is willing to challenge Africa. Today, 4 companies presented are all looking forward to hearing from you. So please contact them by referring the list of contacts. And for any other inquiries, please contact JBCA, and we will make sure to follow up with related agencies and companies. Japan has a famous saying, persistence pays off. With support of AHB, JBCA will continue our efforts to create more opportunities to strengthen Africa-Japan relationships and support our future of better health systems. Thank you again for joining our event. Thank you.
Thank you so much. We look forward to working with you. We look forward to working with the Business Council, and we look forward to manage the process. These are some emails and contacts that you can see on your screen. And I would like to sincerely thank everybody for contacting us. Osamu Sakurai, do you have any comments? I would also like Tomohiko Shugishita, who I can see on the floor, to give us a greeting. Dr. Tomohiko, can we hear from you?
Thank you, Amit. So thank you very much for your good chairmanship. And also thank you very much for attendance all. I think you have a different health system challenges in your country. So please contact me to help you for how it's engaged for PPP in the mainstream in your health sector development. Thank you very much.
Thank you. We will. And Hada-san, we warmly invite you to Africa. I'm getting messages from different people that when you get a chance, the Japan Business Council should come. And any one of these countries that is your favorite, they will be happy to host you.
Thank you.
You can easily tell us. And Osamu, I want to turn it over to you if there are any last minute housekeeping matters, or can we finally come to a close?
Yes, we can come to the end at any time. My very last message was just to announce to you the contact information, which was one slide before. So yes, so this is just my final message. So we can come to, so please feel free to contact any of those presenters, yes, on the list. So they are the contact like persons for you. So thank you very much once again. So over to you, back to you, Amit. Thank you.
I want to tell you to feel free to pick any one of these email addresses. We are working as a team. So don't worry whose email